Hello, my name is Caress Perkins, and I will be doing the Foley checkoff. First, I will start off by checking the patient's chart, looking at the provider's orders, and then I will check the medical record to make sure there isn't anything that will hinder the process of the Foley procedure. After that, I will go get everything that I need for the procedure. And then I will knock on the patient's door, introduce myself, provide privacy, wash my hands, and check 2 patient identifiers, name and birthday. After that, I will go on to explain the provider's orders as well as the steps for the procedure. After that, I will answer any questions the patient has for me. And after that, I will lay the patient flat to a comfortable position, and then I will raise the bed up to my waist, my hips at a comfortable position for me to do the procedure. After that, I would put on gloves and get soap and water and wash the patient's penis, starting at the head of the penis, washing from the meatus, circular motion, and going outward to the base of the penis. Then I will use soap and water to wash the shaft of the penis, going from the base of the head of the penis on down to the base of the shaft on all angles with soap and water. Rinse. And then I will wash the testicles, soap and water, and then rinse. And then I will dry the patient's penis off. After that, I will put away everything that I used to wash the patient's penis, set it to the side, perform hand hygiene, and then I will begin to set up. Before I begin to set up, I will have the patient bend their knees and abduct their legs slightly. And I will put the side of the rail down that I'll be doing the procedure on. Then I'll perform hand hygiene, and then I will start to set up. I'll put everything that I need in the middle of the patient's legs. Okay. I will use this as a plastic bag, trash, to dispose of everything. Now I have a 1-inch border, and I will open up the kit. Okay. Then I have a 1-inch border around the sterile fill pad. And I will place the plastic side at the bottom, facing down. Okay. And I'll get the penetrator pad. I have a 1-inch border around that as well. And I'll place that over the penis. Okay. And after that, I will get my sterile gloves. I have a 1-inch border for that as well. Okay. Then after that, I will pinch the bottom cuff of the glove to put on my first set of gloves. Okay. My first glove, my first set. Okay. Then I will put my 4 fingers into the cuff of the glove, and that will help me slide on my glove. Now I have to keep my sterile gloves above my waist. I cannot touch anything outside of my sterile field. Just as I was putting them on, I was not able to turn my eyes from the sterile field. I always have to keep it in my vision. Okay, I can't touch myself or, like I said, anything outside of the sterile field. Then I will get my sterile tray, set it in its own sterile field. Okay, and after that, I will get the Foley, which is sterile, and I will set it into the sterile field. Okay, still sterile. It goes into, go out and around, dispose of it. Okay, I would get my swabs, tear, go out and around, dispose of it. And I will set it in my tray, go out and around, dispose of it. Then after that, I will get my sterile water, which I'll use this to fill up the balloon, go out and around, dispose of it. And this is used to connect to the Foley line so I can fill up the balloon. And I will put all 10 cc's into the balloon for that. And then I have my dominant hand and my non-dominant. I'll use this. This will be doomed as dirty. And this has to stay clean for the sterile field. Then I have sterile lube that I'll be using. I'll insert this into the meatus, the whole container, tube, go out and around, dispose of it. Okay. All right, so I'll grab the penis and I'll get my swabs. I'll start at the meatus, work my way around, circular outward to the base of the penis, go out and around, dispose of it. Do it again for the second time. Start at the meatus, outward, round, go around, dispose of it. Do it again. At the meatus, go out and around, circular motion, base of the penis, go out and around, dispose of it. Then I will get my sterile lube, and then I will insert the whole container in there to the meatus, to the urethra, go out and around, dispose of it. Then I will get the Foley line, and I will insert this. Now I have to make sure that I do not touch with my dominant hand. Okay. Okay, and at this time I will basically tell the patient to take deep breaths, base down, and if there were any complications or issues, I will stop immediately, and I will have the patient see the doctor and try to figure out what's going on. Okay, now it's in there. You want to get to the sterile water, and you want to insert all 10 cc's into the balloon. Okay, you want to hook it, go out and around, dispose of it. Then you want to pull it softly, not rough or anything, and make sure it's in its place, which it is. Okay, and this glove is now doing dirty. Okay, and I just want to explain what the process will be from there. There's an adhesive sticker that you use to hold this part into place on the thigh. You want to always leave a little some wiggle room, because you don't want the Foley line to come out of the penis, because it will cause a lot of blood, soreness, it will hurt the patient. Then you want to make sure you put the Foley bag on the side of the bed below the patient's bladder. Um, then I would tear the penetrated pad above the penis on the outside, pull it outside, ball it up, dispose of it. And I'll do the same to everything else that I used, dispose of it. Um, I will make sure that the patient's bed is at a safety level, make sure the patient is comfortable, and make sure the call light um, is near or with them. I will let them know to push the call light if they need help or need assistance with anything. Or me and somebody on the floor will be there to assist them. Um, um, After that, put the cover back on the patient, make sure they're comfortable. Um, do all that, and I will ask if they want the door closed or open, lights on or off. Um, and I will do hand hygiene, and then I will go back to work. Thank you.